The symptoms of prostate enlargement really are manifest by two different factors. One is the actual size. As the gland gets bigger, it's harder to push the urine through. The other cause for symptoms with men with prostate enlargement isn't really the size of the gland, but the fact that the gland and the surrounding tissues are involved with smooth muscles. It's part of the normal architecture, but those muscles squeeze down. So as they squeeze the urethra, they block the flow as well. And that's another whole category of medications called alpha blockers that relax those muscles. The advantage to the alpha blockers is that they work very quickly. Men have dramatic improvement in their urinating symptoms almost within days and often avoid the need for any surgical intervention. The problem with the alpha blockers is they may not last as long. So maybe after a year or two or three, the symptoms might start to come back. That's where the 5-alpha reductase inhibitors, the Avodart and the Proscar, come in, and that they actually shrink the gland. And sometimes the combination of the two is really what's best for most men. The Avodart and the Proscar have a very low incidence of side effects that are sexual. The main ones are sometimes you'll have a decrease in sex drive, sometimes a decrease in sexual ability, and for many men a decrease in volume of ejaculate because you're shrinking these glandular structures. The alpha blockers, their main side effect is that they relax the smooth muscles. So depending on whether you're using a new one or an old one, some men can have problems with blood pressure and also retrograde ejaculation, where because the bladder neck is relaxed, when the man ejaculates, the semen goes backwards into his bladder.
That doesn't sound very good.
Retrograde ejaculation is something that we describe, but apparently is painless. Men, though, become very obsessed with how things should be, and when there's changes such as reduced volume, they become upset with that and want to restore it.